So welcome everyone this evening to our webinar. All the medication tips your doctor didn't have time to tell you. We're very happy that you can join us this evening for our Cecelia Health presentation. Should you have any technical difficulties, there is a phone number at the bottom of your screen to call Citrix support at 1-800-263-6317, and the webinar ID is at the bottom of the screen as well. So our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions, and so we look forward to an interactive webinar this evening. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. The Cecelia Health Certified Diabetes Care and Education Specialist will provide you with some strategies to help you manage your diabetes, but this online Q&A session is intended to give general advice only. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecelia Health Certified Diabetes Care and Education Specialist. Our speaker this evening is Nanette Sabell. Let's see. Nanette is a pharmacist who left retail and became a certified diabetes care and education specialist. In her spare time, she volunteers with her local JDRF chapter, going to schools to educate them on type 1 diabetes, and volunteers at a diabetes camp for kids. When she isn't watching movies with her husband of 27 years, she likes to garden and watch birds. So thank you very much, Nanette, for being with us this evening, and you may take it away.
Thank you, and thank you everyone for joining me this evening. Today I'm going to go over all the oral medications, injections that are not insulin, and insulin. And I'll review how and where these drugs work in the body, their recommended dosing, any advantages, the most common side effects, cautions, or warnings. I'll also discuss how much of a decrease in the A1C you can expect at the maximum dose. Many of the medications I'll be discussing will come also in a combination form, meaning one pill containing at least 2 different diabetes medications. However, tonight I'll only be covering the individual medications. Finally, we'll briefly discuss tips for medication adherence. So before I get started into the medications, I wanted to talk about all the TV commercials you may have seen for diabetes medications lately, and they're advertising about a decrease in the chance of heart attack or stroke or congestive heart failure. The reason you're seeing these claims is because in 2000, medications were to conduct research to ensure these drugs would not increase the risk of heart attack or stroke. What's been proven so far is that none of the drugs increase the risk of heart attack or stroke, and in fact, some of them reduce the risk. And I'll mention which of these include as I discuss them today. And of course, manufacturers like to advertise the good news with their medications. So there's many types of medications that are used to treat diabetes. They include oral medications, injections that are not insulin, and of course, insulin. Now I'm going to start with oral medications, and these are a list of fancy names that represent all the different drug classes of oral diabetes medications. Each of these classes work differently from one another with regards how they lower blood sugars. And within each drug class, there can be multiple brand names and generic names, so it's a little confusing. Hopefully after this presentation, I'll clear some of this up. The different drug classes of oral diabetes medications include Biguanides, sulfonylureas, DPP-4 inhibitors, SGLT2 inhibitors, TZDs or thiazolidinediones, glucosidase inhibitors, Meglitinides, dopamine receptor agonists, bile acid sequestrants, and a glucagon-like peptide 1 GLP-1 receptor agonist tablet. So the first I'm going to talk about is metformin, and it's part of the biguanide drug class. The brand name for metformin includes glucophage, Glumetza, and Fortimet. Now, metformin was approved in the United States in 1994 and has become the most frequently prescribed medication for diabetes. Metformin works mainly on the liver, and it's said that the average person with type 2 diabetes has 3 times the amount of normal glucose released by the liver. Metformin helps cut down the amount of sugar the liver releases. It also helps the muscles use some sugar from the blood, which also helps lower your blood sugar. The recommended dose for metformin is starting at 500 milligrams twice a day with food, and it's increased over time to the maximum dose of 1,000 milligrams twice a day. It's recommended to be taken with the last bite of the morning meal and the evening meal, and that's to help protect from the most common side effect, stomach upset. If you take it with food and you still have stomach upset, talk to your provider and they can switch you to the extended release tablets. The extended release should still be taken with food, but because it dissolves at a slower rate, you usually don't have the stomach upset. And there's multiple advantages of metformin. It's inexpensive, it doesn't cause weight gain or hypoglycemia, low blood sugar. Additional benefit with this medication is that it can also decrease cholesterol, and research has shown that metformin may have the potential to decrease the risk of heart disease. Now, the most common side effects are nausea, bloating, diarrhea, some cases headache, and sometimes vitamin B12 deficiency. And if your kidney function decreases enough, metformin should be stopped. Now, metformin can lower A1C by up to 2%. So if your starting A1C is 10% and you were started on metformin, once you are able to take the maximum dose, you could bring your A1C down as low as 8%. Since the recommended goal for your A1C is below 7, typically another medication would be added to get you to goal. Now, the 2% decrease is what the medication at the maximum dose can do. If you increase your activity level and eat balanced meals 3 times a day, your A1C could be decreased even further. So next is sulfonylureas, and they've been around since the 80s. The generic names of the sulfonylureas are glyburide, glipizide, and glimepiride. The names in parentheses are the brand names of these drugs. These drugs work by telling the pancreas to release more insulin. These can be taken once or twice a day. The most common side effect of sulfonylureas are weight gain and low blood sugar. Because the medication is telling the pancreas to release insulin, you shouldn't miss any meals. If you do, you'll increase your likelihood of having a low blood sugar. Another caution is with sulfur allergy, as if you have a sulfur allergy, you may be allergic to this medication as well. Another caution has to do with the sun. When taking sulfonylureas, you can develop a sunburn faster than you normally would, so it's important to always wear a strong sunblock and reapply it often. And these have been found to be neutral for heart disease, which means they don't make it better, but they don't make it worse either. And sulfonylureas can lower your A1C by up to 2%. The next class of medications are the DPP-4 inhibitors, or the dipeptidyl peptidase 4 inhibitors. The brand names include Januvia, Inglisa, Tradjenta, and Nesina. The generic names are in parentheses. People with type 2 diabetes have too much of a hormone called DPP-4 in the stomach. These medications help us to release more insulin when you eat. This medication also helps you feel fuller sooner, so we eat less. Because of how they work, DPP-4 inhibitors have a very low chance of causing low blood sugar, and they don't cause weight gain. The most common side effects are headache, sinus infection, and in some cases, disabling joint pain. And these can lower the A1C by up to 0.8%. Now, I want to take a minute and talk about side effects to any medication. If you experience a possible side effect to a medication, it's recommended that you contact your doctor and let them know what you're experiencing. In a lot of cases, this can be done over the phone, not necessarily a visit to the doctor. And it's safer for you to let the doctor know when it happens instead of waiting until the next appointment. And I understand, no medication is meant for everyone. In this day and age, we have alternatives to most medications. So let's move on to the SGLT2 inhibitors. And that stands for sodium glucose cotransporter 2. And that has to do with where the medication works in the kidneys. The brand names of these drugs are Invokana, Farxiga, Jardiance, and Stigletro. The generic names are in parentheses. In people without type 2 diabetes, when their blood sugar becomes elevated around 180, the kidneys kick in and start to lower blood sugar by getting rid of the sugar by way of the urine. With type 2 diabetes, that doesn't work as well. The body doesn't start to excrete extra sugar through the kidneys until the sugar is much more elevated, maybe as much as 220 milligrams per deciliter or even higher. So what the SGLT2 inhibitors drugs do is they help your body get rid of extra glucose through the kidney sooner. And these medications are taken once a day. Now, some of the benefits of these SGLT2 inhibitors are no low blood sugar, no weight gain, maybe even weight loss, and they also may help lower high blood pressure. Research shows that Invokana, Farxiga, and Jardiance can reduce the risk of cardiovascular death, heart failure, and preserve long-term kidney function. Because these drugs cause more sugar to flow through the urine and bladder, that's where most of the side effects occur. So some people experience bladder infections, increased urination, and yeast infections. And these can happen in both men and women. Diabetic ketoacidosis is rare, and they can lower your A1C by up to 2%, and they can lower your weight by up to 3 pounds. And again, increasing activity, eating balanced meals 3 times a day can improve both of those numbers. So onto thiazolidinediones. These are, the name brands are Actos and Avandia, and the generic names are in parentheses. And these drugs work differently in the sense that they help your body become more sensitive to insulin. They also help decrease the amount of glucose released by your liver. It can take up to 12 weeks before you see the full benefits of these medications. Avandia is taken once a day and Actos up to 3 times a day, and they can be taken either with or without food. The most common side effects are headache, sinus infection, and swelling or fluid retention. And caution should be used if you have liver problems or congestive heart failure. And there's what they call a black box warning on these, which states that they may cause or worsen congestive heart failure. So weight gain and swelling should be monitored daily by the patient. And these can lower your A1C by up to 1%. Now, glucosidase inhibitors. This class includes Precose and Glycet. The generic names are in parentheses. These drugs work by delaying carbohydrates from absorbing, which keeps our blood glucose lower. Now, the glucosidase inhibitors are taken before meals and should be started at the lowest dose and increased every 4 to 8 weeks if necessary. Slowly increasing the dose will help decrease the GI-related side effects. Now, weight gain and blood sugar are the most common side effects. When you have a low blood sugar while taking one of these, then you need to treat the episode with glucose tablets. Other types of treatments will not absorb in a fast enough manner. It's recommended that these be used cautiously in people with liver or kidney problems, and they can lower your A1C by up to 1%. The next drug is Meglitinides. The brand names are Prandin and Starlex. These medications stimulate a rapid insulin burst, so it's important to be taken before meals, so up to 3 times a day. Side effects include low blood sugar and weight gain, and these can lower your A1C by up to 2%. So at this point, there's one dopamine receptor agonist, and it has uses for conditions other than type 2 diabetes, but for type 2 diabetes, it resets our circadian rhythm to improve blood sugar control. Now, what are circadian rhythms? According to the National Institute of General Medical Sciences, circadian rhythms are physical, mental, and behavioral changes that follow a roughly 24-hour cycle, responding to primarily light and darkness in an organism's environment. And by resetting this, you get improved blood sugar control. The exact mechanism behind why this lowers your blood sugar is unknown. It is recommended that you take this within 2 hours of waking up. Some of the possible side effects include nausea, headache, fatigue, low blood pressure, fainting, and it can lower your A1C by up to 0.9%. The next medication goes by the name brand of Welchol. It's not known exactly how this medication works to lower blood sugar, but it's suspected of blocking sugar absorption in the intestine, and it also decreases cholesterol. You would take 3 tablets in the morning or 3 tablets in the evening, or 1 packet of powder in the fluid. Side effects are GI related, and it wouldn't be used if there's a history of bowel obstruction. These can decrease the absorption of certain medication and vitamins, so timing would be sensitive on when to take them, and this can lower your A1C by up to 0.5%. Now I'm going to talk about Rybelsus, and the active ingredient is semaglutide. It's a GLP-1RA that's a tablet. The full name is glucagon-like 1 receptor agonist. Glucagon-like peptide 1 receptor agonist. It's an oral version of Ozempic injection, which I'll talk about in a minute. People with type 2 diabetes don't have enough of a gut hormone called GLP-1. And what we do have gets broken down very fast by another hormone called DPP-4 that we usually have a lot of. Rybelsus works by increasing the amount of GLP-1 in the gut, and they're designed not to be broken down by DPP-4. Therefore, the pancreas can release insulin when blood sugar is elevated, and it helps us feel fuller sooner. The dosage starts with the 3 milligrams once a day for a month, and then that's increased to 7 milligrams a day. And the 3 milligram dose is just to help your body get used to having an extra amount of that hormone. Once you've been on the 7 milligrams for a month, if you need more blood sugar control, then your provider can increase it to 14 milligrams a day. Now, the most common side effects are nausea, vomiting, diarrhea, and headaches. The drugs need to be started, like I said, at a low dose to help your body get used to it. The cardiovascular benefits, according to the FDA, says Rybelsus reduce the risk of heart disease. The contraindications for these are if you have a family history of MTC or medullary thyroid carcinoma, or MEN2, multiple endocrine neoplasia syndrome type 2. Contact your provider if hoarseness or a throat lump develop, and if vision changes occur, notify your physician. Now we're going to talk about the injected form of this medication. And these are weekly injections are Bydureon, Basal, Trulicity, and Ozempic. We have daily injections as Victoza and Adalimumab, and there's a twice-a-day injection called Byetta. Now, like I said before, people with type 2 diabetes don't have enough of the GLP-1, and what we do have gets broken down by that DPP-4. So injecting these helps, and they're modified so it can't be broken down by DPP-4. So you're replacing a hormone, and by replacing it, it's allowing the pancreas to release insulin when your sugar is elevated, and it also helps us feel fuller sooner, which can also always help with weight loss. Now, the most common side effects are going to sound familiar. Nausea, vomiting, diarrhea, headaches. Some of these drugs need to be started at a low dose to help your body to get used to them, and the dose can be adjusted. The cardiovascular benefits with these, Victoza, Trulicity, and Ozempic have been shown to reduce the risk of heart disease. Bydureon, Byetta, and Adalimumab does not increase the risk of heart disease. Same contraindications as with the tablet. Family history of MTC or MEN2, and contact your provider if hoarseness or throat lump develop, and in particular with Victoza, thyroid C-cell tumor, if you've had that as a contraindication. So one last injection that is not insulin is Similin. And Similin is similar to Amylin, and Amylin works together with insulin. And I know a lot of times when we talk about diabetes, it's insulin, insulin, insulin. Well, insulin actually has this partner, amylin. And people with type 2 diabetes, we don't make enough amylin. So injecting it before major meals, we're able to replace what our body isn't making. With more amylin in our bodies, it decreases the amount of sugar released from our liver. Our stomach slows down how fast it empties, which helps us feel fuller sooner, and our blood sugar doesn't increase as much. The side effects are nausea, headache, weight loss, and temporary loss of appetite. If you use this with insulin, the insulin dose needs to be adjusted to prevent low blood sugar. And this can decrease your A1C by up to 0.8%. So let's move on to insulins. And let me point out that insulin is the most effective treatment to lower your A1C percentage. I've been talking about this can lower it up to 2%, this can lower it up to 1%. There is no limit with insulin how low you can get your A1C. This is the naturally occurring hormone, so it's very effective when it comes to improving blood sugar. Some of the insulin come in pre-filled pens, some come in vials as well. Insulins are categorized by how fast they lower blood sugar. We have ultra-rapid, rapid, regular, intermediate, and long-acting. Dosing of insulin is very individualized and is always started at a low dose and increased over time to the effective dose for that person. And keep in mind, as with oral medications, increased physical activity and balanced meals are still part of the treatment with insulin. So I'm going to start with the long-acting insulin, which is also called basal insulin, then intermediate, short-acting, and then rapid-acting, also called bolus insulin. So the basal or long-acting insulins that we have is Lantus U100, Basaglar U100, a biosimilar to Lantus, Toujeo U300, Levemir U100, and these are usually injected once a day, but sometimes twice a day, and can last up to 24 hours. With Tresiba, we have U100 and U200, and they can last up to 48 hours. These control fasting blood sugar, and the most common side effects are low blood sugar and weight gain. And I just want to mention that the U100, U300, U200, that's the potency of the insulins. Kind of like aspirin is 81 milligrams, insulin has its own way of noting how strong it is. So with intermediate acting insulin, we have Novolin and Humulin and U100. One injection usually lasts about 12 hours, so they're usually injected twice a day. They're less expensive than the other ones. The most common side effects are low blood sugar and weight gain. So bolus or short-acting insulin, we have Novolin R, U100, Humulin R, U100, and Humulin R U500 vials and pens. And these are what we used to call regular insulin, which is where the R comes from. And the U500 really is 5 times more concentrated than the U100. And these lower blood sugars after meals. And they're injected ideally before meals, so up to 3 times a day. And the most common side effects are low blood sugar and weight gain. So now we have rapid-acting insulin or bolus insulin. And these are also referred to as mealtime insulin. We have Novolog, Apidra, Humalog, and Admelog. And these should be injected up to 15 minutes before meals, so up to 3 times a day. They can last up to 4 to 5 hours per injection. They lower the blood sugar from the carbs you ate in the meal. And the most common side effect can be low blood sugar and weight gain. So now we have very, very rapid acting bolus insulin, and these are new in the last year. With the rapid acting insulin, the very rapid acting, we have Fiasp and Lumajev. And these can be injected right before you eat, like 1 to 3 minutes before you eat. They can last for as little as 3 hours or as long as 5. And they lower again the blood sugar from the meals. But these insulins work closer to what our body is supposed to be doing with what the insulin our body is supposed to make. Getting it shorter to working and getting the job done is one of the things they're trying to get to help prevent more low blood sugars. People are still having, like with any insulin, possibility of low blood sugar is still there and weight gain. So now I'm going to talk about the inhaled rapid-acting insulin, Afrezza. And Afrezza comes in 4, 8, and 12 unit cartridges, and it absorbs through the lining of the lungs. So before these would be started, they would want to assess your lung function. They wouldn't want to use it if you have any lung disease, because that would increase your risk of having a bronchospasm. Possible side effects is cough, throat irritation, and low blood sugar. Now, across the board, all insulins are neutral in regards to their effect on heart disease. So when it comes to injecting, insulin is absorbed fastest through the abdomen, followed by the arms, and then the thighs and the buttocks. And when you inject in the abdomen or the stomach, you want to stay at least 2 inches away from the belly button or any scars that you may have when using the abdomen. For injecting in the thigh, inject 4 inches or about 1 hand's width above the knee and about 4 inches down from the top of the leg. The best area on the leg is the top and the outer area of the thigh. Never inject insulin into your inner thigh because of all the blood vessels and nerves in that area. With the arm, you want to inject in the fatty area in the back of your arm between your shoulder and the elbow. And with your buttocks, you want to inject in the hip or the wallet area and not lower than the buttocks. So when injecting with an insulin pen, you inject straight in and be sure to hold the pen in place for a few seconds after the insulin is delivered to ensure that no insulin leaks out. And you never share insulin pens with anyone. I always recommend to ask your doctor for the shortest needles available. For insulin pens, it's a 4 millimeter needle. For syringes, the shortest we have is a 6. Exercise that occurs immediately after the injection may speed up absorption because of the increased circulation to the site. If you plan on strenuous physical activity shortly after injecting, don't inject to the area impacted by the exercise. For example, if you plan to play tennis, don't inject into your racket arm. If you plan on jog or run, don't inject into your thighs. When rotating sites within one injection area, keep injections about 1 inch or 2 finger widths apart. Do not inject into scar tissues or areas with broken blood vessels or varicose veins. Scar tissue may interfere with the absorption of the insulin. I know it's challenging to help remember to take our medications, but here are some tips I hope will help. I would suggest buying a week-long pill box. For some people, they like to get 2, one for morning meds, second one for the evening meds. They also have medication baggies that can often hold more pills in them than the pill boxes if you take larger medications. If you have a phone that has an alarm app on it, you can set medication reminders. You can also keep a small supply, like a week's worth, in your office in a labeled prescription bottle. I would also, you can also have, there's a lot of apps now on smartphones that help you with reminders to take medication. sometimes it's as simple as putting a Post-it note by the coffee maker in the morning or on the fridge or maybe with your keys about, hey, don't forget the medication. So now I want to take time to answer any questions you have. If you have one, just simply use the questions section of the online seminar tool, and I'll answer as many questions as possible. Okay, here's a question that I often get. What do I have to do to get off of my medications for diabetes? Well, keep in mind that managing type 2 diabetes, 3 main components: eating balanced diet with not too many carbs, not too little carbs, the right amount of protein, smidge of fat, and nutritious. And a dietitian can help you figure all those details out. So a balanced meal, being active, and taking your medications. If you maximize the activity and the balanced meals, then there's going to be less emphasis on medications. But these are things that it's a lifestyle change. You have to say, I'm going to do this and keep doing this. Because if the medications stop and you go back to different eating habits and different activity levels, really working on the lifestyle to prevent long-term complications associated with diabetes. Okay. Now, so here's one about metformin extended release recalls. I'm sure we've all heard about this. Heard a lot in the news about recalls of metformin. What's it all about? So, December of 2019, some manufacturers of extended release metformin had tested positive for a possible carcinogen. And we get exposed to this chemical in our everyday life. But when you're taking it day after day by a medication approved by the FDA, then something has to get done. So they are now testing extended release metformins, and the recalls are not universal. It's just specific manufacturers. And they have tested the regular release metformin, and they have not tested positive for this NDMA. And it's only been, again, certain batches, certain manufacturers of the extended release. So the FDA has to do something with this information, and so they've told manufacturers, if it's test positive and you're over the acceptable daily limit, you have to recall it. And I'm sure the manufacturers are doing everything they can to get to the bottom of why and how to prevent it. But anytime you see a recall, get in touch with your provider if you think it impacts you, and go with them on what they recommend. Okay, here's another one. When I see my doctor, he seems to be randomly picking drugs for me. I'm not really comfortable with that. Is there a reason why he's choosing which ones for me and when? The short answer is yes. There are guidelines that recommend certain drug combinations, and they're updated throughout the year. That said, the doctor's probably choosing drugs that work in different ways that complement what you're already doing to lower your blood sugar and to help it get under control. You can always ask your provider or diabetes educator about your medication. One thing you typically don't see is like 2 people taking sulfonylureas or a person taking 2 DPP-4 inhibitors. They're always taking different ways of working to complement each other to improve blood sugar control. Okay, here's another one. Prices of insulin. I don't understand why the prices of insulin, let alone medication in general, are going up either. I wish I did. I'd scream it from the rooftops. I recommend my clients to let their doctor know if it's too expensive, and to see if they have any samples, or maybe they have to get samples. There's coupons out there, but the coupons can't be simple coupons. There's requirements and laws behind them. Most manufacturers have a way of helping people with the cost of medication. So there's usually alternatives one way or another, and ways of helping people with the cost of medication. But why it's as expensive as it is, I don't have an answer for that. Okay, it looks like we are out of time. Thank you again for joining us today. I apologize if I didn't get to your question. You may also be interested in upcoming webinars and community forums presented by Cecelia Health Certified Diabetes Educators. March 8th is in Spanish. March 9th, stop focusing on what you can't eat and learn about what you can eat. Healthy eating and diabetes. And April 20th, say no to diabetes complications. Say yes to reducing your risk, keeping kidney, nerves, and eyes healthy. If you want to attend more events, ask your coach. If you haven't signed up for text messages, again, talk to your coach. And great diabetes information and tips, like us on Facebook, Cecelia Health Coaching. Thank you and have a good evening.